Well, hello again, everybody. Today is Tuesday, December 8th. Welcome into another Keep Boone Healthy Facebook video. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. Welcome back to our space. It's been a busy day today with new executive orders being issued by the state of North Carolina and Governor Roy Cooper late this afternoon. We are still dealing with some of the ramifications of our current COVID-19 situation, as we have for the last several months, but also some good news on the horizon, too, that we'll talk about during the course of this conversation about vaccine deployment, what that means for our area, and what that ultimately means for you moving forward. Today, we are grateful to be joined by Dr. Kevin Wolfe. He is a pulmonologist at Watauga Medical Center here in the Boone area. And a lot of conversation has been going around the community about hospital capacity, about treatment options available to patients in the hospital, and just the overall state of healthcare in our community as it relates to the pandemic response. So we figured, like we like to do on these videos, we would go straight to the source and get some insight about what they're seeing at Watauga Medical Center and what we need to know as citizens here in the community about the part that we can play in managing our healthcare abilities here in our community. So Dr. Wolfe, first of all, thank you for joining us and taking time out of what I know has been a very busy schedule for you and your staff here over the last several weeks.
My pleasure. Thank you for having me, David.
I guess to start out with the general question, what is the hospital seeing right now in terms of patient load and the sickness of patients that are coming in and presenting with COVID-19?
Well, there's no doubt that the hospital has seen a definite step up in the patient population with respect to the COVID virus. We didn't get the first national surge when COVID became known here in the United States several months ago. It wasn't until about 2 months ago that we actually had our first admission with COVID virus here at the hospital. But we've seen a definite increase in the COVID population, and as a consequence of that, we are actively redesigning our hospital makeup in order to accommodate those patients. When we first started off 2 months ago, we just had a 9-bed COVID ICU that was set up for any COVID patient who required life support, and it was set off from the rest of the hospital, which was nicely done. It was also in a double pressure situation, so that everything was self-contained within these rooms. And we found out it didn't take long that we filled those 9 rooms, and we had to have more. So we had to expand as the population demanded. And we are actually in the process of opening our 3rd COVID unit here in the hospital right now in order to accommodate those needs.
And I'm sure not only is bed space a concern, but the staffing that it takes to manage that surge of COVID patients, as well as the rest of the hospital operations, has been top of mind there. How have you and other doctors and nurses and administrators worked to balance those needs?
Right. Well, we found out that the COVID patient is very unique in the sense that they're very demanding in terms of their medical needs once they're in the hospital. It's interesting because we have our COVID units divided between an acute critical care unit and a subacute unit as well, so that the level of care that's provided in both of those units is different. But you're right, we can't have COVID patients in the hospital if we don't have the personnel or the equipment to take care of them. And as a consequence of that, we're had to stretch our staff in terms of some of the hours that the staff is working right now. They've been very kind to accommodate that. But more importantly, we just started relying on contract personnel outside of our own system, where we're contracting in registered nurses and respiratory therapists right now to help meet the demand of those patients.
We've heard a lot of the science of this has evolved since the very beginning through even just today, as we talk a little bit more about vaccines and deployment and storage and what that will look like. So with that said, how has the way that you have cared for COVID patients changed? And what does that regimen look like right now for what your staff is being asked to do to be able to provide the level of care that you and your team desire at this point?
There are a lot of models that are presented right now in terms of the standard of care for the COVID patient. For example, the CDC has their own guidelines. The National Institute of Health has a very similar but somewhat different guidelines. as a lung specialist, the American College of Chest Physicians actually has its own guidelines, which are unique in certain ways. What we do primarily is we follow the National Institute of Health guidelines in terms of the medications and the care that's provided. Specifically, there's a lot of agents that are out there in the community right now that are potentially offered, but there are actually only a few that have been accepted from most of these guideline organizations. For example, there's a lot of antiviral agents out there, but only remdesivir has been accepted by most of these organizations as the antiviral treatment of choice in the hospital for patients that meet specific criteria. So you just can't be exposed to the COVID virus, test positive, and expect to get antivirus medication when you come to the hospital. You actually have to have three things. Number one, you have to test positive. Number two, you have to have changes on your x-ray that support that you've got COVID viral pneumonia. And then you have to have oxygen levels that meet certain criteria as well. In other words, your oxygen levels are low and you're requiring oxygen supplementation. And that's by the guidelines. So we try to adhere to those quite readily. And then the other medication that has been accepted is the implementation of dexamethasone or systemic steroids to help counter this inflammatory response that the virus seems to enhance in our bodies.
As you see patients come in, and you just laid out some great detail there about what some of those criteria look like. What are the I guess more readily visible signs of the virus right now that you're seeing from patients? Is it the cough? Is it the upper respiratory nature of this, or are you seeing other consistencies with presentation from those that are actually being hospitalized at this point?
Right. Well, that's a good question, because the symptoms of the COVID virus are varied and can be very uniquely hid, as the case may be. It's a smart virus in the sense that it doesn't have a characteristic set of symptoms. For example, 97% of the people that have COVID virus will have a fever at some time during their course of the illness. But that fever may not be right at the beginning. They say that the symptoms for COVID virus usually begin about 4 days after your actual infection, but the real bad symptoms don't start until about day 8 or day 9. And those then include what would be things like the fevers that they get, the cough are pretty common, the shortness of breath are probably the three most common, but it can be nasal symptoms with nasal congestion, with loss of smell, loss of taste, as the case may be. But it may just be muscle aches. And as you know, there are people with COVID virus that have no symptoms whatsoever walking out in the community, even as we speak.
The strain on your staff, your operation, this isn't day one of going through this. You guys have been at this for months now. And I know you detailed out some of the staffing, but what mental and physical toll is this taking on our healthcare workers in this community right now?
Well, probably the best way to look at it is we have a lot of workers who are investing a lot of time into the system, and all forms of workers in terms of nurses, physicians, respiratory therapists, physical therapists, all aspects of the hospital, the phlebotomists. Everybody is suffering from a little bit of battle fatigue right now, in the sense that it's very wearing because of the constant care that is required for these patients, and helping them to get better. Because as most people are aware, the COVID virus can be fatal.
Your message to the community at this point in time, and we'll talk about some of the good news here in a moment, but as we're still dealing with the current realities of your situation, based on what you see in the hospital, what you understand as trends that the state lined out again today, a little bit more in terms of case numbers continuing to go up and things along those lines. What is your message to the community about the best ways they can support the work that's being done inside Watauga Medical Center and every other medical facility here in and around our community?
Well, we have to be smart about this. The virus is not going to go away, and we're going to be dealing with it for several months as right now. And you know, the easiest thing that people can do is the masks wearing when you're in the public forum, and also the hand washing and the social distancing. Those three things alone are so important in terms of preventing the spread that if everybody practiced that, I think most communities would be better off. But we're actually in the process of taking a really big step forward here, and that's going to be with the availability of the vaccination, which is going to be coming out here in the next within the next week.
And that's the silver lining that we want to get to in this conversation here. We have heard a lot about vaccine deployment from a few different companies now and different regimens based on which company you're dealing with. What information can you give us at this point in time about what to expect in Watauga County, not only in terms of product, but also the way that vaccine will be deployed and what we can expect there from the everyday citizen's view?
Right. So right now the vaccine is being produced by 4 different pharmaceutical agencies. And here in Watauga County, I know that we're going to be involved with 2 of those specifically, and I'm sure ultimately all 4 as time progresses. But the distribution of these vaccinations, first of all, is going to take the form of 2 waves. First of all, next week is going to be the first wave. And to the best of my knowledge, I don't believe that we here at Watauga Medical Center are going to be part of that first wave of virus vaccination distribution. However, it does look, this is not official, but it does look that perhaps during that second wave that's going to come out the third week of December, we will probably be participating in that. What the government, both from a federal and a state level, have done so far is they have made a hierarchy of people who are to receive the vaccination initially. And part of that hierarchy includes, first of all, medical care people who are on the front line of treating the patients with COVID disease. That includes physicians, respiratory therapists, nurses, physical therapists, all the people who are involved in the front line. But it also includes patients who are currently staying at long-term facilities. For example, here in Watauga County would include places like Glenbridge, Deerfield, the Foley Center, and other care facilities like that.
And you know, a lot has been made mention about storage capabilities and things along those lines. I know Chuck Mantooth has mentioned this a few times in public here. Watauga Medical Center seems to be well equipped to handle the variety of different circumstances that you may have to store a vaccine in. Is that accurate?
That is true. We try to stay ahead of the curve as best we can. And when we found out that the Pfizer Corporation was going to have one of the first vaccine availabilities and that their vaccination product required a special deep freeze to keep it in, we have already purchased that specific deep freeze unit so that we can house 1,000 vaccinations within our medical center at time of distribution.
That's good news to hear. I know a lot of people will be reassured to know that, and probably those that understand logistics know that a lot of these plans have been put in place because of months of work behind the scenes at a variety of levels within the hospital to make sure the best care can be provided here. And we certainly look forward to seeing some of the fruit of that labor here as soon as we can get our hands on that. Well, one final question I would like to end with, and I know this is a big source of public speculation as well. You know, we heard back initially in some of the messaging that came out about the COVID responses that, you know, certain age groups, demographic types were being impacted more. Can you give us a sense, without obviously any HIPAA concerns, can you give us a sense of what the demographic looks like of the average Watauga County COVID patient right now, and what you're seeing in terms of age range and other health concerns that might help paint the picture of what we're dealing with overall here in our community?
That's a great question, because first of all, the community needs to understand that the COVID virus is very nonspecific in who it affects. The very young, the very old, all are at risk. But the people that seem to have the worst medical problems related to it traditionally are people who are at the age of 55 to 60, particularly the 65 and older range. and also those patients who have comorbid conditions. For example, those who are overweight, those people who have diabetes, those people who have heart conditions, those people who have lung conditions, those people are particularly at risk for having more illness associated with the virus with respect to their respiratory tract and their cardiovascular system. And those are traditionally the people that are being hospitalized here. Keep in mind, we have had, including right now in our hospital, we have a person who is in his 30s who is on a mechanical ventilation right now who has COVID disease. We had a person who was 44 years old, was actually our first patient who got placed on life support. I'm happy to say that she walked out of the hospital on room air and went home. So there are some good stories that go along with taking care of these COVID patients. But we also have had patients in their 70s and 80s who have also been on life support, and some do very well, and unfortunately, some do not.
I know one final question for you here. I know we've talked a lot in this kind of space before about the need for the flu vaccine and not wanting to compound COVID with a big run on flu here in the community. Do you have any early indications on flu spread here? I'm sure we're probably a little early for that right now, but is that continuing to serve as a concern for medical professionals right now to make sure that those two things don't give the 1-2 punch at this point?
Right. Another good question. Traditionally, this is our peak for the flu season. The first part of December, the last part of November is when we start our flu peak. And that's pretty much on an annual basis. We're not seeing that flu peak right now. And some of that is because we're doing the good things that we're doing to take precautions against the COVID virus. So that's some good news there. But we've learned through the medical research already that some of these viruses can coexist each other. And we've had patients that have COVID virus infection as well as influenza. We've had patients that have COVID virus with other viruses such as the adenovirus, the rhinovirus. And so we have to look for both of those and treat them accordingly. Obviously, the COVID illness usually trumps the other virus in terms of the symptoms and the severity of the disease. So yeah, we have to pay attention to that. It's interesting though, we talk about, the flu season and getting your flu shots. The flu shot in general is only about 30 to 40% effective in preventing the influenza virus. These new COVID virus vaccinations that are coming out are giving between 90 and 95% effective vaccination power. And I think that's a powerful message that the public needs to understand, is that it looks like this is going to be a better vaccination than what the influenza vaccination is.
Yeah, it's an amazing rate. And certainly I know that Dr. Cohen from the state made mention of that when those figures first came out, that she was surprised by that number and was very encouraged by that. And I know others have reiterated too. So it's good to continue to hear that those numbers are holding. Dr. Wolfe, I'll close by saying this, and I know you represent, you're one person in a sea of folks that work at Watauga Medical Center and through Appalachian Regional Healthcare System every day. On behalf of our entire community, we thank you all, every one of you, for the tireless work that you have put in, long hours and longer hours, I'm sure still yet to come, to keep our community healthy. That has been one of the tenets of this Keep Boone Healthy movement, is to continue to listen to our medical professionals and do the right things. You all have been incredibly gracious of lending your skill and expertise and doing so in a way that I know has been tough. But we do thank you for that service and work, and we hope soon you will get some much needed rest and have more normal things to worry about than global pandemics. But we certainly thank you for your time here and your expertise sharing with us here this evening.
You're very welcome, David. Thank you for having me.